This is Chapter 2 of Conquering Scoliosis Pain by Dr. Clayton J. Stitzel. Causes of scoliosis-related back pain. Back pain is one of the most common and frustrating symptoms reported by adults with scoliosis. While spinal curvature itself may not always cause pain directly, the ripple effects of that curve throughout the musculoskeletal and nervous systems often lead to chronic discomfort, inflammation, and fatigue. Understanding the specific causes of scoliosis-related back pain can help individuals and healthcare providers identify more targeted and effective treatment strategies. This chapter explores the key contributors to scoliosis-related pain, ranging from structural imbalances to systemic influences. Muscular imbalances. Scoliosis alters the symmetry of the spine, creating uneven pull and tension on the surrounding muscles. On the convex, outer side of the curve, muscles are overstretched and often overworked in an attempt to stabilize the spine. On the concave, inner side, muscles can become shortened, tight, and weak due to disuse or limited range of motion. This imbalance creates a constant tug-of-war in the muscular system, leading to pain, spasms, and inefficient movement patterns. These imbalances are further aggravated by the body's natural compensation mechanisms. As the spine curves, other areas of the body, such as the pelvis, hips, shoulders, and neck, may adjust in response. This compensatory movement can place abnormal stress on joints and tissues, eventually resulting in widespread muscular discomfort that is difficult to isolate or relieve with standard treatments. Fatigue and muscle overuse. Muscle fatigue plays a major role in chronic scoliosis-related pain. Because the body must work harder to maintain upright posture and balance, muscles tire more quickly. Simple tasks like walking, standing, or lifting objects can place excessive demands on the postural muscles, especially in the lower back, leading to exhaustion and soreness at the end of the day. This fatigue is compounded by inefficient movement patterns. Scoliosis often forces the body to operate in ways that are biomechanically suboptimal, using the wrong muscles for certain actions or failing to engage key stabilizers. Over time, this leads to chronic overuse, poor endurance, and recurring pain, especially in the lumbar spine, shoulders, and neck. Disc degeneration and spinal joint stress. As the scoliotic spine continues to bear uneven loads over the years, the intervertebral discs and facet joints, key components that support spinal flexibility and absorb shock, begin to deteriorate. Disc degeneration occurs when the discs lose hydration and elasticity, causing them to shrink, bulge, or herniate. In scoliosis, this process tends to happen asymmetrically, accelerating wear and tear on one side of the spine. Similarly, spinal joints, facet joints, are subject to abnormal loading in a curved spine. This uneven stress can lead to facet joint arthritis, a condition marked by joint inflammation, stiffness, and pain during motion. As these structures break down, nerve roots may become irritated or compressed, leading to pain that radiates into the buttocks, legs, shoulders, or arms, depending on the location of the curve. Nerve compression. When scoliosis causes discs to bulge or vertebrae to rotate, nearby spinal nerves can become compressed or irritated. This condition, known as radiculopathy, may cause sharp, shooting, or burning pain that radiates down the limbs. Nerve compression in the lumbar spine can lead to sciatica, pain radiating down the back of the leg, while compression in the cervical spine may cause tingling or weakness in the arms and hands. In some cases, scoliosis may contribute to narrowing of the spinal canal, a condition known as spinal stenosis. This puts further pressure on nerves and can lead to numbness, loss of coordination, or severe functional limitations, particularly in older adults with degenerative scoliosis. Postural strain. Posture plays a critical role in scoliosis-related back pain. The spinal curve alters how weight is distributed across the body, which in turn affects balance and alignment. Poor posture, whether from prolonged sitting, standing, or repetitive motions, can aggravate existing asymmetries and lead to muscle tension, joint strain, and even respiratory challenges due to reduced rib mobility. As scoliosis progresses or remains unmanaged, maintaining a neutral, aligned posture becomes increasingly difficult. Over time, this leads to postural strain, particularly in the upper and lower back. The body constantly fights against gravity and its own asymmetry, often leading to pain that is dull, achy, or persistent throughout the day. Hormonal, genetic, and systemic influences. While structural issues are major drivers of scoliosis-related pain, they are not the whole story. Hormonal imbalances, particularly in women, can influence pain levels, joint stability, and inflammation. Estrogen fluctuations during puberty, pregnancy, and perimenopause can alter connective tissue strength and pain perception, making scoliosis symptoms more pronounced during these life stages. Genetic factors also play a significant role. Many adults with scoliosis possess genetic variants that affect bone density, neurotransmitter function, inflammatory response, and collagen formation. These variants can predispose individuals not only to developing scoliosis, but also to experiencing more severe pain and slower recovery. Systemic health issues such as chronic inflammation, autoimmune disorders, nutrient deficiencies, and even digestive dysfunction can further complicate the picture. These underlying conditions can lower pain thresholds, impair healing, and increase muscular or joint sensitivity, making it more difficult to manage scoliosis-related discomfort with standard interventions alone.